everybody! Today we'll be going over the gluteal muscles and the deep muscles of the hip. So we can go ahead and jump right in. Our first muscle today is the gluteus maximus. This is a very well-known muscle. It is one of the largest and heaviest muscles in the entire body. Proximally, it has a large attachment. Starts on that iliac crest, also attaches on the sacrum, the coccyx, the sacrotuberous ligament, and then coming over here, it attaches on the IT band, which is located right here, and the gluteal tubercle of the femur, which is actually a bony prominence on the backside of the femur. Actions, it produces hip extension and external rotation of the hip, and also abduction has a portion in that, and it is innervated by the inferior gluteal nerve. So we can go ahead and hide the gluteus maximus. And then underneath, we reveal a large array of muscles. This is very interesting. Our next one on the list will do glute medius. Now, if there was ever a muscle that I'd call the goat of this region, it is the gluteus medius. This guy does a lot. He's really cool. So I'll tell you all about him. It starts on that iliac crest on the posterior aspect again, coming over here to attach on the greater trochanter of the femur. And because of its muscular orientation, it can do a lot of action. So it can do abduction, so bringing the leg outwards. And because of its fiber orientation, some of them have this anterior fibers right here, and then the posterior fibers sit right here. The anterior fibers do internal rotation of the hip, and then the external rotators do external rotation of the hip. So it does both rotations. Not only does it do all those motions, but it prevents Trendelenburg gait, which is a hip drop while people are walking. And you can see that in people's gait patterns and all that. So it's a very, very important muscle. Very, very awesome. And this is innervated by the superior gluteal nerve. So we can go ahead and hide this guy. Right underneath the glute med lies the glute min, but in between those two is the entire neurovasculature of this region, including the superior gluteal nerve, the superior gluteal vein, and the superior gluteal artery. And so right here, we'll talk about the glute min next. This is the glute minimus. And again, attaching on that posterior aspect of the ilium, just slightly lower, and then coming around to attach to the greater trochanter. This one primarily does internal rotation of the hip, as well as hip abduction, bringing the leg out. Also innervated by the superior gluteal nerve, right there. So we can go ahead and hide this one. After the glute min, I want to talk about the 6 deep external rotators of the hip. These guys are really essential in holding the femoral head into the acetabulum, or really providing stability to the hip joint, similarly to the rotator cuff with the shoulder. And so, but since the hip is heavier and has a lot more forces that it handles, there's 6 of them, not just 4. And so our first one on the list is the piriformis, which is our first muscle right here. It attaches proximally on the anterior aspect of the sacrum, coming on down to attach to the greater trochanter of the femur, produces external rotation, and is innervated by the nerve to the piriformis, which is a very great name of the nerve. Simple name, very easy. And I did want to talk about an important relationship here in this area. All the neurovasculature that innervates the gluteus muscles is named with respect to the piriformis. What do I mean by that? If we can scroll in here, I can show you, is that right here, you can see this neurovascular bundle right here. This is called the superior gluteal nerve. Here's the superior gluteal vein and the superior gluteal artery, all going to innervate and vascularize the glute minimus and the glute medius, right? These are called superior because they emerge superiorly right there to the piriformis. And then our next couple, here is our inferior gluteal nerve. Over here we can see our inferior gluteal vein and our inferior gluteal artery right here. All 3 of those go to innervate and vascularize the glute max, come out below the piriformis, hence their name, inferior gluteal nerve and artery and vein, which is really cool. So that's an anatomic relationship of naming that we have in this area. So we can go ahead and move on. Next couple are these 4 muscles right here. These 4 muscles also have a relationship. So these split 2 and 2. The top 2 have the same innervation, and then the bottom 2 have the same innervation right here. And they're both named after the muscle on the bottom. So what do I mean by that? So here's the superior gemellus and the obturator internus. Both of these are innervated by the nerve to the obturator internus. Similar relationship down here is the inferior gemellus and the quadratus femoris. These are both innervated by the nerve to the quadratus femoris. So both of those sets of muscles are innervated by the same nerve, and it's just the name of the muscle beneath it is that nerve. So our first muscle here is the superior gemellus, attaching to the ischial spine of the ischium, and then coming over here to attach to the greater trochanter of the femur, producing external rotation, and again, innervated by the nerve to the obturator internus. Our next one here is the obturator internus. Before I show you these, I got to show you the os coxa, which is this whole apparatus of the bone, which is the ilium, the pubis, and the ischium. It forms a circle over here, and this right here is called the obturator foramen. Now they have two muscles right here, is the obturator externus and the obturator internus. They're both named off of this obturator foramen, and externus and internus with respect to which area they attach on there. Externus attaching on the anterior aspect, and then internus attaching on the posterior aspect. So right here we have the obturator internus, and you can see how it covers that whole circle right there on the posterior aspect of it. And it wraps around, comes around here, wraps around the ischial spine, and then comes around here to the greater trochanter of the femur to provide external rotation. And this one is innervated by, pretty easy, the nerve to the obturator internus, which is great. Our next one here is the inferior gemellus, and this one attaches right here to the ischial tuberosity, and then comes across here to attach to the greater trochanter of the femur, also producing external rotation, and innervated by, like we talked about the relationship, the nerve to the quadratus femoris, right there. Next up is our quadratus femoris. Similarly with the quadratus lumborum, it's a four-sided muscle, 1, 2, 3, 4, attaching right here to the ischial tuberosity, which I keep saying that, it's this big bony prominence right here on the ischium, right there. And then it comes around to attach to the, right below the intertrochanteric line of the femur to produce external rotation, and it's pretty easy. The innervation is called the nerve to the quadratus femoris, which is great. Our next muscle is the obturator externus. So just similarly like the obturator internus, the proximal attachment is just right over the circle, right over the foramen, except this starts on the anterior aspect instead of the posterior aspect of the obturator foramen. And then does the similar relationship, it wraps around posteriorly, and then comes around, bends around to attach to the greater trochanter of the femur right here to produce external rotation of the hip. And then this one is innervated differently. It's innervated by the posterior branch of the obturator nerve. And so we can go ahead and hide this one. Before I move on to the next musculature, I do want to talk about an important relationship right here. And so right here, I wanted to show you the sacrotuberous ligament. This is a very broad ligamentous attachment on the posterior aspect of the sacrum. Attaches to the ilium, the sacrum, and then sends a line and ligament all the way down to the ischial tuberosity. And with its relationship, I'm going to hide the coccygeus so we can see this. Right here is our sacrospinous ligament, attaching from the sacrum to the spine of the ischium, right here. These two ligaments crossing form two holes, or foramens, in the body. This one is called, and you can see this large one up here is the greater sciatic foramen, and then this small one is the lesser sciatic foramen right here. Out of the greater sciatic foramen is all the neurovasculature that we talked about for the gluteal muscles, so superior gluteal vein, artery, nerve, inferior gluteal vein, artery, nerve, along with the massive sciatic nerve. That's why it's called the sciatic foramen, because this is the thickest nerve in the entire body. It is an absolute cable of a nerve, and that one goes through the greater sciatic foramen. Notably, that the one thing notable that goes through the inferior gluteal or inferior sciatic foramen right here is the pudendal nerve. This is the pudendal nerve, very good nerve. It innervates the cutaneously, so like feeling sensation of the genitalia of both male and female, and the perineal area, which is the area between the anus and the genitalia, as well as motor function, innervating all the pelvic floor muscles to help us keep urinary and fecal continence as well. So very important nerve, and but yeah, that's what I want to talk about with the ligamentous and foraminal relationships there. Our last muscle that I wanted to talk about with you today is the TFL, also known as the tensor fascia lata, and it's called that because it tenses the fascia on the lateral side of the leg, which is really cool. So this big fascial thing right here is called the iliotibial band, or the IT band, and the TFL attaches right into it. So it starts up here on the ASIS, or the anterior superior iliac spine, and then it inserts right on the IT band, which goes across and functions as its tendon essentially, comes down the leg, crosses the knee joint, and attaches inside Gerdy's tubercle of the tibia. On the lateral aspect is Gerdy's tubercle, and it provides lots of stability to the lateral side of the leg. And when the TFL contracts, it actually produces hip flexion as well as knee extension. Knee extension is really interesting, but it's just because of how when this whole fascial compartment tenses, it crosses the knee joint and straightens out. It helps straighten out the knee. So really important muscle, very great. This one is also innervated by the superior gluteal nerve. And those are all the muscles of the gluteal region and the deep external rotators of the hip. I hope this helps. I hope you learned something. Thanks you so much for watching. I am the PT guy, educating you on God's wonderful creations. I'll see you in the next one.